patient who's fallen out of a tree. By their screams I can tell that they've good airway management, so I'm not concerned about that. It's just in the backyard. We've got our PPE gear on. Are you safe?
Yep.
Okay. Hi there, I'm Tahlia and this is Joe.
Hi.
Do you know what's happened to you today?
Yeah, I fell out of a tree.
Do you know where you are?
Yeah, outside my house.
Can you tell me your name, please?
Nikita.
Okay, Nikita. So, because Nikita is responsive, her eyes have followed me around. She's able to answer my questions, obey commands. I'd say she's got a good GCS of 15. Okay, Nikita, you've got quite a laceration to your arm there. I'm just going to manage that for you if that's alright, and I'm going to get Joe here to take some vitals.
Yeah, it's fine.
Okay. Okay, so the first thing I'm going to do with the laceration is I'm going to clean it out with some saline solution. Next I'll take a bandage, wetting it with the same solution there so it doesn't stick to the wound. I'm folding it to minimise the surface area so it increases pressure to where the laceration is. I'm taking my bandage, wrapping it around her wound tightly to keep pressure. Also, if I want to increase the pressure, I can rotate the bandage on the side of the laceration. So now I'm just checking to make sure she's got her radial pulse still there. Yeah, that's good. Nikita, can you feel this?
Yeah.
Can you grab my hand for me? Okay, good. She's got good motor sensors there. I'm going to elevate this. Hopefully it'll stop the bleeding. In cases where it doesn't stop the bleeding, like it has not now, I'm going to repeat the same steps, putting another bandage on and folding it also. Wrapping the bandage around again and again, twisting it to increase the pressure. Again, I'm going to be taking the radial pulse. Yep, she's still got a pulse. Can you still have sensation? Can you squeeze my hand? That's all good. So elevating it again. Now, in cases now where it hasn't stopped, what I'm going to do is apply a tourniquet at least 10 centimetres above the laceration to a single bone and not on a joint. Nikita, so here I want to put a tourniquet in your arm. It's just to stop the bleeding, considering all the bandages haven't. It's going to be quite tight, but uncomfortable. Is that alright?
Yeah, it's fine.
So gain the patient's consent. Putting the tourniquet on and pulling it tight. Then twisting this here, locking it in place. I'll record the time and I'll be leaving the tourniquet on until we get to hospital. So now I'm just checking for a radial pulse as the tourniquet is cutting off circulation. There shouldn't be a radial pulse. So they're not here, so I'm going to take off the bandages now so that I'm able to assess the wound. So with the tourniquet, as it is actually cutting off the blood circulation, sometimes it can cause ischemia. Right, so we can see now that the blood has stopped, so that's all good. Now Nikita, what I want to do is do a trauma sweep, so I just want to feel around to see if you have any pain, and I want you to tell me where it hurts, if that's alright. I'm just going to be touching you. Okay.
Ow.
So where is that? Is that on the side of your neck or in the centre?
Centre.
Okay, I'm just going to get Joe to hold your head for me while I continue doing some trauma sweep. At the same time, I'm checking for any blood. No, making sure the pelvis is still intact.
Ow, ow, ow.
Pain there on the ankle?
Yeah.
Okay. So now we've discovered there's pain in the ankle and in the neck, but due to the mechanism of the injury and the fact that there's C-spine tenderness, could indicate to me that there's an injury to the C-spine, so I'm going to put a C-collar on first to stabilise her neck. So now Nikita, I just want to put a C-spine collar on you. It's going to stabilise your neck because you don't want that moving around in case you've got any injuries. So with the C-spine collar, you're sizing it up by measuring from the shoulder to the jawline, so she's got about 3 fingers, so I'm going to put Nikita on short. So if you size it up by sizing it from the bottom to the top. I'm just going to get Joe to lift your head on lift. Ready, set, lift. Contraindications with the collar is that it can increase intracranial pressure, it can traction the spine, and also make the airways hard to manage. So I'm checking to see if the size is right. This size looks to be good. If it wasn't, however, I'd just take it off and do it again. I'm just going to take some more vitals. So, is it alright if I just take your blood pressure, please?
Yeah, it's fine.
So, have you had your blood pressure taken before?
Yes, I have.
Okay, so you know it's going to be a little uncomfortable.
Yes.
So, I'm lining up the line where it says artery with her brachial artery. So I'm going to feel for her brachial pulse, and I'm going to be pumping the cuff up until I can no longer feel her pulse. So I can't feel her pulse anymore. I'm going to give it one more squeeze. Now I'm going to be listening for the first beat and the last beat, and that'll tell me her systolic and her diastolic. So Nikita has a blood pressure of 90 over 50. So the normal range for the systolic blood pressure is 90 to 140. Above it, you'd be considering hypotension, and below you'd be considering above you'd be considering hypertension, and below you'd be considering hypotension. Now I'm just going to take her heart rate for 15 seconds. So I've taken Nikita's heart rate 15 seconds and I'm timing it by 4 to get a heart rate of 60 beats per minute. And I've also, without telling her, taken her respiratory rate, as when you mention a respiratory rate, they can begin to control their breathing. And so I've also taken this at 15 seconds and times it by 4, and she has a heart rate of 15. So normal ranges for, a respiratory rate of 15. Normal ranges for respiratory rate is between 12 and 20, and for heart rate it's 50 to 90. And now I'm just going to oscillate and give your lungs a listen to, if that's right, Nikita?
Yeah, that's fine.
So I'm listening to superior and inferior. Deep breath, please, with your mouth open. And the other side. I'm just going to go underneath, if that's alright. Deep breath. And again. Okay, so I was just listening for any crackles or wheezing, but she's got normal sounds. So some of Nikita's vitals indicate to me that she might be at risk of being in shock, so I'm just going to get Joe to administer some oxygen at 2 litres per minute via the nasal cannula. Okay, now Nikita, I'm just going to assess your ankle. I'm just going to expose both your lower legs, if that's alright.
Yeah, that's fine.
So the first thing I'm doing is checking for a pedal pulse. So yep, I can feel them, and checking the other foot as well to make sure they're equal. So she has equal, moderate pedal pulses. So now I'm just going to check for her sensors. Nikita, can you feel this?
Yeah, a little bit.
And can you feel this?
Yeah.
Okay, can you push against both my hands with both your feet? Okay, so she has more sensation and a lot more mobility in this foot than this foot. I'm just looking at the abnormalities. This one's kind of in a different direction than this ankle. It's a bit of swelling. So I'm just going to decide to before I splint this, I'm just going to give her some medication to help ease the pain. So Nikita, would you be able to rate your pain for me on a scale of 1 to 10, 10 being the worst?
Oh, solid 8.
Okay. Nikita, have you ever had methoxyfluorine before?
No.
So you haven't had it within the last week?
No.
Do you know what malignant hypothermia is?
No.
And do you have any renal impairment?
No.
No. Okay. Joe, can I just see that for a second? Now can I get you to read it out loud to me, please?
It's a 3 ml dose of methoxyfluorine, and it expires January 2019.
Okay, so I've checked the drug so it's safe to use. Nikita, now what I'd like you to do for me is to put the strap around your head and then inhale and exhale through this green whistle here. So it doesn't taste the nicest. You can feel quite lightheaded, maybe a bit nauseous, but it's going to help to ease your pain. So just taking deep breaths in and out for me, please. Nikita, so how's your pain going? Is it better or worse?
Oh, so much better.
Out of 10, would you say it's lowered?
No, yeah.
Okay.
3.
So this is good for the short term. It's good for short term management.
Is alright?
Yeah.
We're recording.
Yeah, we're good.
I pick up the rubbish.
Oh yeah, that's fine. So, that's good for short term management. But in the long term, if I wanted some better pain, I'd give her paracetamol, making sure it's at the right dosage. She's under 80 kg, so it'd be at 1,000 milligrams. So now Joe's prepared to split for me. Nikita, I'm going to get you to take a few deep breaths for me, and we're just going to move your leg into the splint, okay? Okay, so I'm just going to count down from 5, Nikita, and John's going to lift your leg, and I'm going to pop the splint under it, right? 5, 4, 3, 2, 1. So we've got the splint in. How's your pain feeling, Nikita? Okay, that's good. So we're going to slide the triangular band over.
Oh, this is good, methoxy.
And we're going to tie it in place just to stabilise the wound. So I'm going to wrap in a figure of 8 around her foot and tie it in place. We're making sure to stabilise the fracture above and below where it is, not tying on the fracture either. So now I'm just reassessing the limb, taking the pedal pulse again, making sure it's still there. Yep, so it's still there and it's still quite moderate. I can feel it really well. It's in the same rhythm as this. Nikita, can you feel this on your toes? Yep. Okay, that's good. Can you wriggle them at all for me? Okay, so she's still got sensation and function, so those are all good signs. Now, Nikita, we've called for backup, so we're just getting you ready for the extrication, and the paramedics will take over from there. Sweet.
Good.
And we're also going to be giving you a blanket just to keep you warm.